Dentistry is subdivided into two wide sectors: NHS treatment, private treatment. Practices can choose to be solely NHS, solely private, or a mix between the two. The majority which tend to be the latter. In this article, we will explore the different ways NHS price banding works and key questions the interviewer may ask you related to this topic. If you're an NHS patient, then the price you pay depends on the treatment band you fall into. There are 4 bands of treatment under the NHS. These cover an array of treatment options. They are as follows. Band 1. This includes a dental examination, diagnosis, advice, radiographs and scale and polish. Band 2. This includes permanent fillings, root canal treatment, extractions, denture relining and periodontal treatment for gum disease. It also includes everything in Band 1. Band 3. This includes everything in Band 1 and 2 with the addition of any denture, crown or lab work, for example, bite guards. Band 4 Emergency. This is emergency treatment. It includes getting a patient out of pain and dealing with the aspect of emergency that they arrive with. This can include temporary fillings, dressing extraction sites with alvagel, extirpating nerves and so on. NHS dental treatment is cumulative, meaning that if one needs 1 filling or 5 fillings, the price is the same, as long as the treatment falls within one treatment plan. A new treatment plan is usually devised at least 2 months after the previous treatment plan has been closed. The prices of NHS treatment usually show a slight increase at the start of each dental year, April of that year. However, due to the increasing costs associated with COVID-19, the current prices as of December 2020 are Band 1 Emergency £23.80, Band 2 £65.20, Band 3 £282.80. Some people are exempt from paying NHS treatment and receive free treatment. This includes, for example, if one has working tax credit, job seekers allowance, maternity exemption, pension allowance, not state, HC2 certificate, universal credit, and a few others. One can opt to be either an NHS patient or a private patient, or have treatment that consists of both. It is essential you discuss this during the treatment planning stage with your dentist. NHS dentists are paid in accordance to the number of UDAs, units of dental activity, that they deliver over the year. Different practices pay a different value per UDA. The number of UDAs per band are as follows. Band 1 equals 1 UDA, Band 2 equals 3 UDAs, Band 3 equals 12 UDAs, Band 4 Emergency equals 1.2 UDAs. It is essential that practices meet their yearly target set by the NHS before the new dental year commences each April. Every NHS patient must have an FP17 form filled for them, which they sign prior to treatment to show their consent. They also receive a copy. This will highlight the total cost and the treatment they will undergo within this treatment plan. They will also sign an exemption or PR form. This is a form which highlights any benefits they have to allow free treatment or whether they pay for their dental treatment according to NHS charges. It is important to note that the NHS checks these and any fraudulent claims incur a £100 fine in addition to the dental charges undergone. Dentists do not charge for the following treatments: stopping bleeding in the case of post-extraction, for example, removal of stitches, issuing prescriptions, although the patient may need to pay the pharmacy to get their medications if they are not exempt. The NHS banding system is a hot topic for interviews, and the following are just a few questions you may be asked during the process. Do you think the NHS banding system is practical in modern day dentistry? Should the NHS banding system be scrapped for a fee per unit system, and why? What are the positives and downfalls of the NHS banding system? How do you present private treatment options to an existing NHS patient? Do you think the NHS banding system is fair for dentists and/or patients, and why?